Hey everyone, welcome back to my channel. I am Khushi and I am going to discuss the topics of head and neck and face. So today I am going to start with the first topic, which is scalp, and this head and neck face has itself more weightage in the examination, and so I started with this section so that we can score good marks in this first examination of university. So all the best for university examination early enough, because this topic will be there and there if your university examiner is very good to you and wants to let you score good marks. Then the scalp topic is one thing that you can write in very good way to score full marks in it. So let's begin with the topic. Let's go for it. So first topic, scalp, has to be discussed in this many topics. The first is definition, second is extent, third is structure, fourth is the arterial supply of scalp, then comes the venous drainage, and then the nerve supply and lymphatic drainage. After lymphatic drainage, I will also explain the clinical applied anatomy, so that we have to complete everything that is given in this topic. So let's begin with the topics. So here we are going to learn about the definition. So as the definition says, the soft tissues covering the cranial vault forms the scalp. So there are soft tissues which are covering the cranial vault, and that is known as scalp. Moving on to the next slide. Extent of scalp. Anteriorly, supraorbital margins, and posteriorly external occipital protuberance and superior knuckle lines, while on each side there will be superior temporal lines. Here it is shown the scalp is extended. So here it is shown this line is the supraorbital margin. This is the superior temporal line, and this is the superior knuckle line, while this is the superior knuckle line, and lastly this here there will be external occipital protuberance. So this is all about the extent of the scalp. Now we go to the next topic, and that is structure of the scalp. The scalp is having 5 layers, and according to its name, scalp, S means skin, C means connective tissue, A means aponeurotic fascia, and L means loose areolar tissue. Lastly, P means pericranium. So from this mnemonic, you can remember the layers of the scalp, which is very easy to remember. First, skin is hairy and is adherent to the epicranial aponeurosis via superficial fascia, and it has more number of sebaceous and sweat glands. Then the second thing is connective tissue, fibrous and dense in center, then at periphery, contains blood vessels, binds skin to aponeurotic fascia, provides proper medium for passage of vessels and nerves to skin. So these are the features of connective tissue layer. The third layer is the aponeurotic fascia, and it is a freely movable layer on pericranium along with the adherent and overlying skin and superficial fascia. Occipitalis muscle has two bellies of occipitalis muscle and two bellies of frontalis muscle, both inserted into epicranial aponeurosis. Now, occipitalis is small and separate, while frontalis is longer, wider, and partly united, which raises the eyebrows and causes horizontal wrinkles on forehead. Loose areolar tissue. It gives passage to emissary vein, which connects extracranial veins to intracranial veins, venous sinuses. And the pericranium last is the loosely attached to surface of bone and firmly adherent to sutures where sutural ligaments bind pericranium to endocranium. So these are all about the structure of the scalp layers. Okay. Now the next slide is layers of scalp is described in this figure. The first one here shows that there is skin with hair, then there is superficial fascia with blood vessels, then comes the third layer which is the epicranial aponeurosis, then comes the loose areolar connective tissue layer, then the third layer is the epicranial aponeurosis, then the fourth layer is the loose areolar connective tissue layer, and the last fifth layer is the pericranium. So here are the layers of the scalp. These are all the layers of the scalp, which is again shown in this figure, in which we can also see that it shows the skin, superficial fascia, then extension of epicranium. This is the temple side of the scalp, means on the temporal side it will be showing these layers. First is skin, then is superficial fascia, then the extension of the epicranial aponeurosis, and then the temporal fascia, and lastly there will be our then will come the temporalis muscle. So here the extra thing comes is the temporal fascia and the temporalis muscle. Here the loose areolar connective tissue is not present, and lastly we have the pericranium. So this is the mandible shown here, this is the auricular muscle. Okay, and here we can see the orbicularis oculi muscle, and this part is the frontalis muscle, which is partly fused united. This is zygomatic arch, this is temporal line, then comes the occipitalis muscle. Yes, then comes here the occipital protuberance, external occipital protuberance, superior knuckle line, then epicranial aponeurosis. So this part is the epicranial aponeurosis shown here, right? And in this figure we have, this is dural venous sinus here, this is dural venous sinus, this part is the sutural ligament, then comes is the emissary veins, these are the emissary veins, and lastly this layer is the endosteal layer. And so this is all done about the layers of the scalp. Moving to the next slide. Now the arterial supply of scalp. So here we are going to learn about two parts. One is in front of ear or auricle, and the other is behind the auricle. So in front of the auricle we have three arteries supplying the scalp. First is the supratrochlear artery, second is supraorbital artery, and the third is superficial temporal artery. Then behind the auricle there are two arteries. One is the posterior auricular artery and the other is the occipital artery. So these are the arteries which supply the scalp. Now we will see it in a figure. So here the arterial supply of scalp is given in this slide, and here we have the all the arteries which I already mentioned earlier. This is the supratrochlear artery. This is the supraorbital artery. Then comes is the superficial temporal, posterior auricular, and the occipital artery. These three are the branches of external carotid artery, while the upper two ones are the branches of ophthalmic artery. So these are the arterial supply of the scalp. Moving to the next slide. Venous drainage. So now, in venous drainage, we can see here, firstly, there is supraorbital vein, then supratrochlear vein, then they fuse to form the angular vein. After that, angular vein will convert into the facial vein. Now, here on the superior ophthalmic and inferior ophthalmic arteries are seen around the eyes. Veins are seen. Then comes is the cavernous sinus. So these are draining into cavernous sinus. Then comes is the pterygoid plexus. So here comes is the pterygoid plexus. Now pterygoid plexus has emissary vein and the deep facial vein, while these two, deep facial vein and the facial vein, combine, and here there is our superficial temporal vein, and from that we have the maxillary vein and also retromandibular vein. Now this retromandibular vein goes down and will partition, it gets into two division. One is the anterior division and the other is the posterior division. The anterior division will communicate with the deep facial and the facial vein and form the common facial vein, and that will terminate or drain into the internal jugular vein, while posterior division will combine with the posterior auricular vein, which is this one, and that will drain into external jugular vein, which will again drain into subclavian vein. So in this way the venous drainage is completed over here. Now moving on to the next slide. Nerve supply. So there are two types of nerves which are supplying the scalp. One is the sensory, the other is motor. Now here also, in front of the auricle, so in front of the auricle, that is this part, it is in front of the auricle. Okay, so this is in front of the auricle. So in front of the auricle we have five nerves, while behind the auricle we have five nerves. Okay, so first we have the supratrochlear nerve, supraorbital nerve, zygomaticotemporal nerve, auriculotemporal nerve, and temporal branch of facial nerve. While it's not in this sequence, so I will be preferring the figure for it so that it gets more simpler to understand, because this way you will not able to remember the sequence how it is present in the in order. So for that I am going to prefer the figure and I'll explain there only. So here we can see first is the supratrochlear nerve, then comes as the supraorbital nerve, then comes the zygomaticotemporal nerve, then the temporal branch of facial nerve, which is motor branch, and here is the auriculotemporal nerve. So these are the first five before the ear, means in front of the ear. These are the sensory and motor nerves. The motor one is the temporal branch of facial nerve, which is motor, while other all four are sensory. Now behind the ear we have posterior division of great auricular nerve, posterior auricular nerve, which is motor, again motor. then lesser occipital nerve, greater occipital nerve, and the third occipital nerve. So here are the other five, and from which the posterior auricular nerve is the motor. So for remembering this, you will have to practice the diagram and write it down, the names also, so that you can remember them forever, because it has no mnemonic to remember. If you remember the mnemonic also, you will have to get to know what are the names of the nerves. So better to write it down and practice this figure for at least 5 times, so that you can understand and you can remember the nerves also. Now ahead, we have lymphatic drainage. Here we will learn about that anteriorly it is draining into preauricular or parotid lymph nodes, which are situated on the surface of parotid gland, and posteriorly it drains into the postauricular or mastoid lymph nodes and the occipital lymph nodes. So here we come to know that the lymphatic drainage is anteriorly and posteriorly. So anteriorly draining into preauricular or parotid lymph nodes, while posteriorly it is draining into postauricular or mastoid lymph nodes and occipital lymph nodes. So here we complete with the lymphatic drainage also. Moving towards the next slide. Here we come to the last and the final slide of these, that is the clinical anatomy of the scalp. Firstly, because of abundance of sebaceous glands, scalp is common site for sebaceous cyst. So the first thing is the sebaceous cysts. The second is the wounds of scalp bleed profusely because the vessels are prevented from retracting by superficial fascia. Bleeding can be arrested by applying pressure at the site of injury by a tight cotton bandage against the bone. Third is that because pericranium is adherent to sutures, because pericranium is adherent to sutures, collections of fluid deep to pericranium known as Cephalon-hematoma takes the shape of the bone concerned when there is a fracture of particular bone. The next one is that loose areolar tissue layer is also known as dangerous layer of scalp, because emissary veins which course here may transmit infection from scalp to cranial venous sinuses. Then we have collection of blood in loose areolar tissue layer causes swelling of scalp, and blood may extend anteriorly into the root of nose and in eyelids, as frontalis muscle has no bony insertion. That will result in the black eye, which we can see in movies also, that a villain is hit in his eyes, and because of that his eyes becomes black, and that is because of this frontalis muscle has no bony insertion and it is attached in the epicranial aponeurosis, and thus when there is accumulation of blood in that layer, and that will cause the blood to come down into the nose area and the eye area, which causes the black eye. Because of spread of blood, compression of brain is not seen, and so loose areolar tissue is also known as safety layer of scalp. So safety layer and dangerous layer both is loose areolar tissue. Now, first three layers are known as the surgical layers of scalp or scalp proper, while because here the uh, surgeries can be done, and the baldness is also seen, which is most probably common in males. So these are the clinical anatomies of the scalp, and I think it will let you score good marks when you attempt to write all the clinicals in it. because we are studying for medical, and we should know that what are the clinicals related to the topic that we are writing in the examination or we are reading in our books. So that is the important thing to mention in your examination. In each and every question you should mention its clinical anatomy, and you will get a plus point over there. Moving on to the next slide. Here it is the black eye, this is the black eye, and this is the baldness. Thank you so much for watching. Make sure that you subscribe to my channel and also hit the bell icon to make sure that you get the first notification that I have posted a new video. And also give a like and comment down below which topic you would like to get notes and explained the next, and I hope that it was helpful. Thank you so much for watching. Bye bye.